example about the hand hygiene, because this is most frequent and important. How I will observe the people behavior for hand hygiene. I will go to say, okay, you're doing good. Okay, fine, you're doing fine. No. Since 2002, we have a clear recommendation coming from WHO. This recommendation will guide us of how we will observe what are the tools we already apply. I am sure in your hospital, in your place practice, you are following this protocol. Not because I know where you are now working, but I know that all the countries now all over the world following up the recommendation of WHO, as you will see now. In infection control, they give us this form. They call it Save Lives, Clean Your Hands, and this is the observation form. We go to the unit and make the audit and fill this information. What is this information? Is facility, the unit, kind of service, either medical, surgical, ICU, medical, surgical, neonatal ICU, OPD, kidney, whatever. The ward, as you call it in your hospital, like maybe some hospitals they call it first floor, some hospitals they call it A100 something, regardless, because this you will use it in the reports. Sometimes the reports in the hospital, we make the reports based on the unit that we call. So we say that, for example, ICU first floor, ICU second floor. But the reports already come to the Ministry of Health and the WHO, it will go like critical care service. So we collect them together based on this report. The department, and of course the country, like you are in UAE, Jordan, Saudi Arabia, Egypt, whatever. So the country will be written in this way. This form, and it will focus here, start, end, time. I am infection control. I will observe the people from to, and this from to, it will have the session duration, and the session duration should be written in minutes, not in hour, not half hour. No, it should be by minutes. So we will know exactly. And of course, some reports they ask for the city and which city you are observing or you are sitting, because this is a national report. Now, we know how the infection control should be performed, right? We know how the infection control, the hand hygiene will be have applied. Now, we will know that our ask or make audit, is the people do it in a proper way or not? And here, doctor, we have the problem. Let's say that you are infection control and you go to the unit. Directly, what will happen in the unit? We will have Hawthorne effect. What is Hawthorne effect? Do you hear this word before? Hawthorne effect. Is there anyone here hear the concept Hawthorne effect? Hawthorne effect. Maybe in research, the people here. Anyway, it's will be applied بالinfection control. يعني كتير من the people working in infection control, they are concerned about Hawthorne effect. What's the meaning of Hawthorne effect? Hawthorne effect, it's name of town in UK. Only because you are inspecting. Yes, I will change. Thank you very much, Doctor. Thank you. It's a name of town in UK, and what happened in that town, the researcher would like to investigate the impact of light on the employee performance. In manufacturing, they make two times. The first, they make the light much stronger and check the performance of the employee. And the second time, they make the light lighter, little lights, not so much high, and they observe the performance of behavior, employee, how the production rate. But they come to be shocked by the result. There is no difference. Hypothesis, they said, if we make the light more, the production will be more. But in both cases, the production were more. In both cases, the production was better than the previous performance. And after investigation, they discovered that people change their behavior when they already observed, when they think that someone observed them. That's why the behavior of people is different when they see camera in the market or in the restaurant, even if this camera is not working. Now maybe I put camera that is not working, but because you think that this camera, maybe it works, you will change your behavior. This is the Hawthorne effect. Now, why we come to this in the infection control? Oh, because of the hand hygiene. This is exactly can happen, and the WHO were aware about this one. As I am infection control, and the nurses, they know that I am infection control, and when I come to the ICU, directly what they will do, they will start to make the hand hygiene all those ampoules. So it's important to think about this one. So how I will solve this one to ensure that there are some techniques, we call it anti-Hawthorne effect, which is simply just stay for the unit for the time, try to not be observed, and also assure the performance in a proper way. And here there are people discussed, or many researchers describe the ethical concern. Is it ethically to observe the hand hygiene of the people without their own consent? What do you think? Now, we know in the community that I should take consent form or approval of person to observe his behavior. That's what happened in the psychology research and so on. But what about the hand hygiene? What do you think? And before we will come to the WHO, what did they say? What do you think? Should I come to the unit and say, oh, staff, I am infection control, I am Dr. Abdul Karim, and I will do the hand hygiene check? Or to come like, the 007, come make insights and see, oh, okay, do it or not do it. What do you think? Which is better, or which is ethical? Something between, okay. Yeah, thank you, doctor. Anyone else? What you're feeling when you say that someone observing your behavior? Tell the facility, not specific units. Okay, thank you, doctor. Yeah, it's already fair enough. Based on the WHO, they said that when you agree to work as a healthcare practitioner, you have to follow these policies, and you have to be observed to assure that you are already doing what you have to do. So the WHO, the two opinions are right, but the WHO said that it's not necessarily to inform the staff who are observing their own hand hygiene, because they already sign a consent when they already employ that they have to follow the facility policy. So this is also an apart from the WHO. While already I agree with you, doctor, that maybe it's much a better ethical concern to tell them, the people, that maybe you will be observed at any time in this day without specification for which time that we will come. The second techniques come from the WHO that said it's important to put some cameras and make the observation in non-direct way. So we put like a camera on the hand hygiene places, like maybe in the tap water or for the back hand rub solutions, and also observe their own behavior of hand hygiene. The third technique said, okay, it's not necessarily to track each person, rather than let's track the unit. So we will say how much bottle of solution this unit already used per week. If they are using higher number of bottles, that means they are doing better hand hygiene solution. Do you understand that? If they are utilizing more soup, that means they are doing more hand hygiene. So these all techniques already come in parallel. Now let's come to our basic intervention. When someone would like to work on infection control, usually we assign him or her for a unit and say, okay, go and stay there, work with the people, observe different things. One of these observation is the hand hygiene. So how they will observe and what are the reports they will do? They will follow up this checkbox, and this checkbox will prefer or classify the staff hand hygiene based on the 5 moments. I'm sure that already you aware about these 5 moments, which is the time mandatory for the staff to do the hand hygiene when they're already dealing with the patient. The first moment, it's before touching the patient. The second comment, before cleaning aseptic procedure. The third, after body fluids. And the fourth, after touching the patient or after touching the patient's surroundings. So I'm sure you already know this, right? Because we are all working in a hospital. So of course, we take so many training about it. Now, we would like to take you to the second level and observe the other's performance of hand hygiene. So we will come for this one. The first part of the paper that you will follow, we call it OPP, which is mean the opportunity. What's the meaning of opportunity? Opportunity of the staff to do the hand hygiene, which means the situation when we are closed for any of these moments. So this moment, when the patient, when the nurse or doctor do or should do the hand hygiene, we call it opportunity. Now, the opportunity will be either he will do or he will not do, right? So the opportunity will be either in before patient, before aseptic, before patient fluid, after patient, or after patient surrounding. So it's written here, bare abbreviation for the space, but the infection control staff will be aware about how to do it. Now, what are the hand hygiene action? There are 2 types of hand hygiene, either hand rub or hand washing. So both, we call it hand hygiene, either hand rub or hand washing, and the situation will be hand rub, hand hygiene, mist, or now the nurse or the gloves. So we will follow up if before or after the gloves he already make the hand hygiene. My question is, which is better, to do hand rub by alcohol swab or to make hand washing by water and soap? Sorry. What do you think is better, hand hygiene or hand rub? Which one is better? Hand rub has better compliance. Okay. Is it part from the compliance? Exactly. Thank you very much, Fatin. Hand rub, when we don't have visible solid, this is the recommendation of WHO. When we have observed things in the hand, so we have to do hand washing. Now, for the doctor said about the compliance in part of the data, both have low compliance, unfortunately. Unfortunately, both have low compliance. And even that the hand rub is taken much more fast and easy, but the compliance for do it in a proper way still concerns, especially among the people had some sensitive skin, and this alcohol or these solutions make for them some irritations. They prefer to not do it at all. So I agree with you. Thank you very much for these comments. Yes, hand rub when we don't have visible solid. When we have visible solid, we should go for hand washing. This is the action here. So when I come to observe someone's behavior, I will tick for which one, and I will tick if he do hand rub or hand hygiene or mist. Now, when I will make it as a mist, when already important step of hand hygiene is not performed in a proper way. So I will observe. Of course, from my observation from distance, it will not assure that I am following all the steps. So I'm focusing on the major steps. Now, if I have more than one staff together, يعني I am observing in ICU, and there are 3 doctors, 5 nurses, 2 respiratory, 1 X-ray, who I will observe. It's smart and techniques of infection control to choose one from the beginning and be fair enough. So I choose Dr. Ahmed, for example, Dr. Muhammad, Dr. Mansour, Dr. I will just only check for this. The others do it in a proper way. It's not my business. Just focus on this one. This is important for the techniques. And it's ethical consent that you will not change this person during or evening during of the observation. So this is regarding to the hand hygiene. I just give it to you here briefly. I think we are all familiar about the 5 moments, but for the infection control staff, they are sometimes facing challenge of how they will use this tool, and it will be a very nice experience. Believe me, I think after a while you will start to learn from the others, learn from the observation, and we come to conclude or calculate at the end based on number of your observations, how much already done in a proper way, how much not done in a proper way, in which moment you followed, and is it hand hygiene or hand rub, and how much the compliance rate based on all of these steps. Yani, it takes time until we clarify how we will make the analysis, because the analysis will take in consideration based on the table that the indication and the compliance. So we'll come to say that if the before patients, usually we do hand rub or hand hygiene or mist, how much the rate of mist among these observations.